Hi everyone, my name is Patrick and I want to talk to you a little bit about cerebrovascular accident. So CVA is also known as a stroke. Strokes take place when the brain does not get enough blood. There are two ways for this to take place. Either the artery is blocked or it's bleeding. The risk for stroke has increased by 50% over the past 2 decades, and 1 in 4 adults is expected to experience a stroke in their lifetime. Risk factors for stroke are your typical culprits of cardiovascular disease, such as high blood pressure, too much cholesterol, salt, sugar, not enough physical activity, and so on. Someone who is suffering from a stroke will mainly have weakness, drooping, or numbness to one side of their body. They may become dizzy, sensitive to light, or be confused. There is a small window of time for rescue, and the treatment depends on what kind of stroke it is. Ischemic strokes are caused by a blockage and is treated with clot busters, surgery, and blood thinners. With hemorrhagic strokes, the bleeding is managed through surgery. Stroke and hearing loss. Most patients suffer a degree of tinnitus after experiencing a stroke. The type of hearing loss will depend on the artery involved during a stroke. If it involves the temporal lobe, patients may struggle to process and interpret sounds, even if their hearing is normal. A stroke involving the brainstem will result in asymmetrical hearing loss. They will have difficulty localizing sound and processing speech. If the stroke affects the inner ear, then a sudden sensorineural hearing loss and vestibular symptoms will take place. So here is our patient, Amy G. Dalla. She is 67 years old who suffered a left side ischemic stroke 4 months ago. She has weakness to the right side of her body and has expressive aphasia with intact understanding. This means she can understand speech but struggle to find the words to speak and express herself. Her medical history includes hypertension, hyperlipidemia, PTSD, tinnitus, and right side profound sudden sensorineural hearing loss. Her family history are listed below. Amy is a retired war vet. She loves to interact with the people in her small community. She volunteers at the food bank and attends church regularly. Since her stroke, Amy has withdrawn socially due to embarrassment and listening fatigue. She is emotional and struggling to cope. Amy feels useless even though her husband is very supportive. Through interprofessional collaboration, our goals for this patient highlights restoring her strength and independence so she can return to her usual routine, and to improve her ability to communicate, to boost her confidence, and reduce stress on her mental health. Our team will involve several health professionals. Her family physician will manage her medications and chronic conditions. The neurologist will follow up with her stroke symptoms. A psychologist can help her manage PTSD, regulate her emotions, and coping with tinnitus. The OT will help restore independence and can help assess her home for modifications. The PT will provide exercises for strength and balance, and the SLP will address Amy's expressive aphasia. The pharmacist will work with the physician to help manage her medications and prevent reactions. And finally, the HIS will address her hearing deficits. Regarding Amy's hearing solution, as the HIS, we would discuss using a cross system to transfer sound from her blind spot to her better ear, helping reduce listening effort. We would provide her the highest technology level to prioritize noise reduction. And accessories like a remote mic will help Amy hear speech better in background noise. We would also discuss sound therapy to help manage her tinnitus. Most importantly, Amy will need counseling to understand what these devices can and cannot do. As an example, the lady here is wearing an Omega AI RIC from Starkey, which is available as a cross system. Well, that concludes my talk about hearing loss secondary to stroke. Thank you for your time. Thank you for listening.